You can start now, Dr. Callahan.
Okay, thank you so much. So good evening. Welcome to the New York City Health and Hospitals Fiscal Year 2020 Virtual Annual Public Meeting for the Borough of Staten Island. Before we start the formal program, I'd like to call your attention that we do have interpreter services available. If you require these services, please dial 212-788-3359. That's for Spanish. I should say 212-788-3359 para Español. I think that would be more appropriate. But anyway, thank you. If you do need those services, again, please call that number. My name is Dr. Vincent Calamia. I'm the Staten Island Borough City Council representative on the Board of Directors. And I want to thank all of you for joining us. I would like to introduce some of the other board members who are here tonight. We have the board members from the other boroughs. Borough representatives. One is Helen Artiega Landaverde. She's our city council representative for Queens. Thank you, Helen. We have Robert Nolan, our city representative from the Bronx, and Barbara Lowe, our city council representative from Manhattan. We also have tonight other board members, including Frida Wong, Fenyasky Peña-Mora. I do believe Sally Hernandez Pinheiro is joining us as well. We have Jose Pagan, who's our chairman of our board, and Dr. Mitchell Katz, who's the president and CEO of Health and Hospitals. Also on our panel are Andrea Cohen, senior vice president and general counsel, and she's going to be serving as our moderator this evening. As well, we have Galicia Hercules, who is secretary of the corporation, but also responsible for making this happen tonight, I can assure you. On behalf of the board, I'd like to also extend our thanks and acknowledge the leadership for our wonderful facility at Seaview Rehabilitation Center. Matthew Levy, his dedicated staff, they provide extraordinary services to our public health system and to the people we serve. And to all of you who are on this evening, thank you for your support as we strive to provide equal access for safe, affordable, quality care to all New Yorkers. And with that, I would like to turn over the microphone to our president and CEO, Dr. Mitchell Katz, and he will continue with his remarks. Thank you.
Thank you, Dr. Calamia. I'm Mitch Katz. I'm the proud president and CEO of the New York City Health and Hospitals. And on behalf of the board of directors, our dedicated workforce, thank you for joining this virtual annual meeting. We're deeply appreciative of the commitment to public health care that you're demonstrating by connecting with us tonight, and we look forward to hearing your comments and concerns about the current and future state of New York City's essential public health care delivery system. As the safety net provider for all New Yorkers, our commitment to the patients and communities we serve has never been stronger. Last year, we provided care for more than 1 million New Yorkers, of which 375,000 were uninsured. In fiscal year 19, we provided approximately 5.1 million outpatient visits. There were 152,000 hospital discharges, and we brought more than 15,000 newborns into the world. Of course, the most dramatic event of the year was our response to the COVID pandemic. I'm so grateful and proud of how well the healthcare heroes across New York City Health and Hospitals performed, risking their health and their lives to care for an unprecedented surge of critically ill patients. We're tremendously saddened by all the lives lost to this pandemic, particularly the members of our own workforce. We will always remember their sacrifice. As we continue to respond to this unprecedented global public health crisis, the safety of our staff and patients remains our first priority. While the healthcare system in Wuhan, China, and parts of Italy collapsed, we did not. Even though our public health infrastructure is aged, our resources are limited compared to some private hospital systems, and the needs of our patients, even in non-COVID times, is great due to the effects of living in poverty, institutional racism, poor nutrition, chronic stress, and higher prevalence of chronic disease. Not only did we meet the challenge of patients coming to us, but we were able to accept transfers from several independent hospital systems that became overwhelmed at a moment in time. Our transformation work over the past 2 years and our smart investments to expand telehealth services, to adopt a unified electronic medical record system, to hire more nurses, to launch a new inter-facility ambulance transport system, really served to lay the groundwork for our success in dealing with COVID. We had begun our planning in January and February. After all, we're veterans of emergencies, having lived through Ebola and Superstorm Sandy. But still, we never could have imagined what would happen. In a 6-week period of time, we grew to 4,000 COVID patients and almost 1,000 who were intubated. We tripled the ICU capacity from a starting point of 320, a feat that I would normally say under regular circumstances would take at least 3 years for a hospital system to be able to do. We did in 6 weeks. We transferred nearly 900 patients across our system to alleviate demand from key facilities experiencing a large influx of patients. And we answered the anxious calls of more than 80,000 New Yorkers who used the hotline to get their questions answered and their symptoms assessed. Within a week of documented community spread of the virus, we converted all routine face-to-face visits to televisits or telephonic visits. We also handled 13,000 patient messages during the pandemic through our MyChart portal. To protect our heroic workforce and create a safe and supportive environment, we prioritize supplies and equipments, the practical and emotional needs of our staff. We provided relief to many frontline clinical staff by adding temporary supplemental staffing, including 4,000 nurses, 500 providers, 250 environmental health workers, and 200 plus other ancillary services. Through persistence, tough negotiating skills, and a new centralized ordering system, we were able to support the 600% increase in demand for PPE to deliver safe care and protect our workforce. We lessened the impact on the elderly and frail in our long-term care facilities by leveraging the shared resources of our integrated system. And we took steps to protect our staff and patient inmates in our correctional health services. Our behavioral health and Helping Healers Heal teams across the system teamed up to provide emotional and psychological support to our staff, because we know that none of us will be the same after going through this crisis, but leaning on each other will help us heal and come out stronger on the other side of this pandemic. And we organized a fundraising operation like no other, thanks to the tremendous generosity and support of New Yorkers, people all over the US and all over the world. We received more than 20 million in cash and in-kind donations to lighten the load for our frontline staff with free hotel rooms, 3 meals a day, which, remember, at this time all restaurants were closed and people had no time to order food, free taxi rides, because at this time the transport system was not running at full speed, and there was tremendous worry about exposures in the subway system, childcare so that people could work extra shifts, scrubs, grab and go groceries, and even Girl Scout cookies. Thanks to the healthcare professionals of health and hospitals, more than 8,365 New Yorkers recovered and returned home from the hospital. Many New Yorkers avoided healthcare during the surge, and we have since getting over the hump of April. We've implemented a number of safety protocols to make people feel safe to come back, so that the necessary services that prevent cancer, that maintain people's health through immunizations, we're still able to provide. We've been actively involved in suppressing the virus through our test and trace team. It's the nation's largest contact tracing initiative. It enables us, with the support of nearly 40 community-based organizations, to isolate and care for those who test positive for the virus, and then rapidly track, assess, and quarantine anyone they may have infected. To date, we've completed more than 3 million COVID tests at more than 30 sites and through partners at other locations citywide. We're able to reach more than 90% of new cases, and we're at 75% of all new cases completing intake, meaning that they're isolating at home or at a hotel with our help. Nearly 3 months since the program's launch, COVID-related visits to the emergency department, case numbers, hospitalizations, deaths, and test positivity rates are markedly lower since the epidemic began, and we've been actively working to try to push down infection rates in localized areas of Queens and Brooklyn where there have been more infections in the last few weeks. We recognize that even people who survive COVID may have long-term side effects, and we're therefore pleased to be opening COVID centers in Bushwick, Jackson Heights, and Tremont to provide pulmonary care, radiologic, and diagnostic services, as well as mental health services with people who continue to have needs. Beyond the coronavirus, we want to close the healthcare gap to make sure that all New Yorkers have access to high-quality care. Through the support of the mayor and our community partners, we reached the citywide expansion of NYC Care with the launch of the program in Manhattan and Queens on September 1st, ahead of schedule, making it easier for New Yorkers who need us most to connect to the quality healthcare we deliver. And I want to mention that Vanderbilt has been a great success as a Gotham site in Staten Island, and we're very proud of the care that it provides. We have already enrolled 30,000 members who have had over 85,000 provider visits, 17,000 telehealth visits, and more than 30,000 prescriptions. We also want to make sure that the strong commitment of health and hospitals to racial and social equality is heard loudly. I'm proud to have supported our staff who joined the White Coats for Black Lives movement, in solidarity with thousands of Americans who've taken to the street to protest the repeated injustices. And on June 9th, staff all across our health system stood firm against racism and violence at a demonstration and moment of silence to honor the life and memory of George Floyd. We also want to keep our focus on our mission of quality and excellent care. And over the last year, we opened a new Pride Center. We strengthened connections between primary care and mental health services. We expanded express care, urgent care services on-site and through online visits. We enhanced services for patients with substance use disorder. We improved services for patients with hypertension, diabetes, and heart disease. We expanded access to care for patients with disabilities. We launched peer-to-peer telesupport for our Metro Plus Health members. We expanded our arts and medicine program. We developed population health strategies to better serve homeless individuals. We helped our patients address food and housing insecurities. We launched reentry and transition services to improve continuity and quality of medical care. We began plans to open outposted therapeutic housing for incarcerated individuals, and we advocated against dangerous federal policies that discouraged immigrants from seeking medical care. Overall, whatever the future brings, we know that health and hospitals will be here to focus on those people who most need us, to make sure that people who are vulnerable have the care that they deserve. I'm so proud of all the great work and all the great people at Health and Hospitals, and I look forward to the rest of this hearing. With that, I'd like to pass the microphone to our General Counsel, Andy Cohen, who will explain the rules of the road for the rest of the hearing. Thank you.
Thank you so much, Dr. Katz. Most important thing I can say now, we have at this point, short speakers list. So if anybody would like to join the speaker list, it is open until 6:30, just a few more minutes. And the number that you should call to put yourself on the speaker list is 212-788-3359. So that list will be open for just a few more minutes. I want to reiterate for anybody who recently joined the call that, or the program, that we do have language translation services available in Spanish. I wish, like Dr. Calamia, that I could say the numbers in Spanish, but I might get them wrong. I'm close next time. But the number that you should call if you do require translation services is the same number, 212-788-3359. As you all know, we are conducting our fifth and last in a series of annual meetings for New York City Health and Hospitals. This evening, we are convening virtually because of the COVID-19 public gathering restrictions. This is the last of our 5 meetings. The purpose of these meetings is to inform the public on the programs and plans of New York City Health and Hospitals, as you just heard extensively from Dr. Katz, and also to allow the public an opportunity to present oral testimony or to submit written testimony concerning New York City Health and Hospitals' performance. All of the testimony that we hear tonight will be transcribed and forwarded to all members of our board of directors. Obviously, there are many here with us this evening listening to it live, but for any who are not able to be here, they will receive a full transcript and documents that are submitted this evening. And ultimately, there will be a summary provided of these annual events. The most important thing to understand when we get to our speakers list is that we are here to listen to you, and the board is here to listen to the public, to hear your comments, and if you have them, concerns, and not to engage in a dialogue. So it's no Q&A. No one from the board or Dr. Katz will be responding to questions. They will just be listening to you. So for each speaker to have an opportunity to testify, our rules provide that speakers are allotted 5 minutes of speaking time. There's an electronic timer that you will see on a corner of your screen that gives you warnings about the time. It will go green when you begin speaking, yellow when there are 2 minutes remaining, and a red light will turn on when your time has expired. When it begins to flash, a few seconds later, you will have exceeded your time, and I will interrupt you and ask you to conclude your remarks. You can submit any testimony that you weren't able to speak or any additional testimony by calling that same board office number, 212-788-3359, to make sure that you are able to provide a full statement into the record. I'm going to turn to my colleague to see if we have a speaker. Yes, we do have a speaker. I'm sorry, I just need to see the name. Thank you. Joseph Tornello, a Community Advisory Board member at Seaview, is our speaker. Okay, we are going to wait for a moment for Mr. Tornello, my apologies. Joseph Tornello, can you hear us? We can't hear you, but it looks like you are on. You can go ahead. We think you may be muted. We can't hear you. Can you unmute yourself?
Hello?
Very good. We can hear you now.
Yay.
Yay. Okay. So you don't need the video as long as you have me there. I don't have the video. All right. Should I give testimony at this point? Are you ready for me? Okay.
Yes, please. Yes, please.
Okay, I'm presenting testimony today. Good evening. My name is Joseph Tornello, and I'm presenting testimony as the past chairperson of the Seaview Community Advisory Board, the CAB, and as current president and CEO of Meals on Wheels of Staten Island. That's my work. Welcome to the members of the New York City Health and Hospitals Board of Directors, and greetings to Matthew Levy, Executive Director at Seaview Hospital Rehabilitation Center and Home. In recognition of this beautiful and historic site, which has served the residents of Staten Island and the city of New York since 1905, now for 115 years. I am the son of a man who was an immigrant and naturalized citizen who worked here as a nurse's aide during the years that the facility provided care for tuberculosis patients. He worked there up until the early 1960s. When Seaview put itself out of business as a tuberculosis hospital, Dr. Robachek finding the effective treatment for tuberculosis back in those days. I'm also proud to have served Seaview on the Community Advisory Board going back to the year 2000. And as an employee, I directed community programs in the 1980s there, as I give testimony today. In addition to the high quality of care provided in a nursing home facility, Seaview has created and maintained specialized care that serves the entire borough. In the 1980s, the adult day service program was established during the early years of that type of service in New York State. Seaview's long-term care nursing home care has continued to include rehabilitation, care, highly regarded Alzheimer's care, and brain injured units, part of its history that addresses specific special care needs. It's worth noting that as a direct result of the overall quality of care, Seaview has won several awards and recognition, including the prestigious Codman Award from the Joint Commission, HHO, which at that time was the only long-term care winner in this award in the country, and the first award in this category of care. We're very proud of this accomplishment, and especially appreciate the direct care nursing and medical staff and administration for attaining this esteemed recognition. In service to the community, the Seaview campus has been the site for the development of senior housing at Park Lane in the former nurses' residence, developed into affordable senior housing with access to supportive services. The Seaview campus is also planned to include the future building of the new Meals on Wheels of Staten Island facility, and the campus has been presented by New York City Economic Development Corporation for development as a healthy living campus, really illustrating Seaview's role beyond the care of residents in the long-term care facility, but as a resource to the entire borough. During this year, dominated by the impact of COVID-19, we know that Seaview has protected the safety of residents and visitors, utilizing personal protective equipment and exercising all safety protocols. And the staff and their leadership are commended for their efforts. With this said, we look confidently to the New York City Health and Hospitals to use the esteemed history of success of Seaview, continue to maintain and extend a significant impact on the Staten Island community. New York City Health and Hospitals can be proud of its long-term care, multi-service facility at Seaview with its long history of service to the borough and recognized quality of care. As Staten Island continues to see significant population growth, we look forward to the future growth of Seaview and an increased commitment of New York City Health and Hospitals to accomplish a wide range of healthcare services and facilities currently available in all 5 boroughs of the city. Are there any questions anyone has? You know, as a lifelong resident of Staten Island, I could say Seaview has always been has always had an important role in the community, and has been the representative of the Health and Hospitals Corporation, and now, of course, Health and Hospitals on Staten Island. And that concludes my remarks.
Great. Thank you so much for your testimony. We very much appreciate it. And it seems as though we have not received additional requests to be on the speakers list. So that also will be you were the first and the last speaker on our program.
No, I'm glad I was able to log in. I've been watching the testimony, trying to figure out how to get in here until my daughter came and helped. My 27-year-old daughter happened to be around and got me logged in. So thank
we
God.
are grateful to her too.
Yes.
Thank you so much for your statement. And
Okay.
we will close out the program tonight. Thank you for being
Okay.
here to make the statement. Good night.
Good night.
Good night. Thank you.
Good night, everybody.
Thank you, Vince. Great show.
Thank you all for being here. Take care.
Take care.
Invite us back, Vince.
For sure next year.